I'm Dr. Winston Tolan, an active participant with the Strangers Mobile Clinic, an active supporter of the Strangers Pharmacy Limited. Of course, they are now moving into new horizons, and Clearsight Ophthalmic Consultants, Strangers Pharmacy, and New Angels, New Vision Distributors are collaborating to deliver glaucoma screening and intervention. Glaucoma is a leading cause of blindness in Jamaica, and while not curable, can be treated. And this program, Saving Is Your Vision, aims to reduce the incidence of glaucoma-related issues while alleviating some of the financial burdens that people who live with glaucoma have to bear. And we'll later on put the persons who are involved most actively on the seat in the driver's seat here, as we asked both Mr. Ron McNally, the CEO owner of Tree Pharmacy, the man with the vision behind the Tree Mobile Clinic, and Dr. Riley Ricketts, an optometrist, who was also the visionary also along with Sir Mac in the mobile eye clinic. Mr. Mac and Dr. Riley, what made you decide to create the glaucoma screening and intervention project?
Thank you, Dr. Tolan. Um, I think right after the pandemic, the first CE I attended face to face was on glaucoma. But something struck me when the presenter said about 80% of our glaucoma patients are not known. And I found that telling and compelling. But I think as I reflected on my own life and I realized I became 50 years old this year, I said to myself, what could I do other than what I'm doing as a gift? So I thought about it, and as if the Lord said to me, why not do a clinic on this, zero in on glaucoma? But it's interesting because I thought I kind of shoved it off, didn't want to bother with it, the cost of it. But he said, why not collaborate? Then I reflect on Dr. Riley's own intervention in my personal life and our family, in which I recall my second son, we went to her with our daughter, which is the third child, but by chance my wife said, you know what, my daughter had a lazy eye, so everybody came along. So my wife said, why not just let everybody get a check? When Dr. Riley looked at my second son, she said, no, pause this girl. This is serious. And the way she explained it to us, it was so easy. And she simply said, your son eye should be like line, the shape of it, the ball, but it's like a marble. It's too round. And she explained the intricacies. But the thing that stood out is when she took him under her wings, made the referrals, and gave him glasses. It changed his life. This was a young man who the teacher warned and said, we're going to work with him. He would not sit still all over the place. And the first day after the glasses, the teacher called and asked us if there's something as a magic glass, because she has never seen transformation like that. To cut the long story short, my son just blossomed. A brilliant child. And when I look at that, I said to myself, who best to tell about this and to be a part of this venture than Dr. Riley Ricketts? Because of the compassion she showed and the interest and the detail. And I said, here's my person. And so I reached out, and she shared her own experience being in the field for so many years. And I said, I need somebody else. And I looked around, and Boops, New Vision, Mark Law, my good friend, my best friend, one of the sharpest businessmen I know. And when I said it to him, he said, Mark, it's a long time I want to do something to help people. Not about the profit or money, but just to help. And when I said it to him, he said, listen. And interestingly, I told him about Dr. Ricketts. I said, can we have a 3-way conversation on the phone? He said, no. I have to meet in person. I have to look in the person's eye when they're talking. I want to know that this person wants to do it like I want to do it. He would not entertain a three-way conversation. So we made the appointment, and we had met the evening, and we all sat and we spoke about what we see happening and how we can solve it. And after the meeting, he said to me, Mark, I'm ready. I feel it. It was very interesting. And so that's the genesis of it, and that's how this came about. I put it as God taking three people and share the same concern, we have the same vision, and it's today a reality. And so, based on the fact that we now know that glaucoma screening is not mandatory, it's not popular as it ought to be, and I like how Dr. Riley puts it, it's actually a silent killer, just like hypertension. And we cannot allow this to go unnoticed. And so we want this to be more educating our people and also looking at solution and how we can bring everybody on board for this very important disease that can be treated. And it is one of the leading causes of blindness, and this we need to fix.
Dr. Riley, you are the person who's going to front all of this, and I know you have partners on board too. Why is it necessary at this time that we should venture into this sort of field, and how serious is the issue of glaucoma in Jamaica?
Okay, when Ron came to me 2 years ago and said we need to get this thing done, I was really very comfortable with what I was doing and realized that he mentioned the 80% that's still undiagnosed. I had known that globally at least 50% is undiagnosed. I also had known that by 2040 we're going to have 111 million people suffering from this disease, and on all fronts, all the main players, the developed nations, have been putting things in place, preparing for the future. So I knew that I could not sit back when I was now talking with somebody who was actually looking ahead. I knew that I would have to get involved. Now, glaucoma globally is 3.54% of the population. And a little after speaking with Rowan, I became involved with a practice, an optometric practice, and realized, surprisingly, that 15% of the individuals needed glaucoma services. That was mind-blowing. And so I would say it was actually a nudge for me to actually be a bit more ethical and look, if I say I'm in this business to save lives, eyes, this I couldn't ignore anymore. So in doing some screenings between August and now, I'm finding, one, we're having people with intraocular pressures is about 6%, but that in itself, high pressures in the eye, which we call ocular hypertension, may not lead to glaucoma if there's early intervention. So if we could go out in the field, as Rowan has suggested, get the necessary equipment, which are handheld equipment, get the skills. And so I've been actually partnering with the Optometry School in Trinidad, and they send clinicians over for a 2-month period. We go in the field, we take the pressures in the eye, but we're also conscious that there is an aspect of glaucoma which is a lot more sneaky, and these are the people who develop a degeneration of their optic nerve with low pressure. So now we had to go a little further, get skilled clinicians again to actually be examining the optic nerve in the back of the eye. So we have handheld cameras that's doing that. And we're actually finding that it's about 12% of the people who have damaged nerves that do not have very high pressures. So now we're looking at a population, particularly in Jamaica, that seem to have the far more dangerous one because it's not as easily detected, and that is normal pressure glaucoma.
is there a particular target group or age group and people with comorbidities that you are targeting?
Right. We are targeting those who are over 25. So we're looking at 25 to 100 years old. Those are the people that we set out to find. We also go into the health centers, and we're finding that of the people who have what we call vasospastic issues, um, diabetes, hypertension, migraine, we're finding that there's quite a bit of that. So those are risk factors. So we are finding a high percentage of the risk factors which contribute to glaucoma. Also, quite a high percentage of uncorrected refractive errors.
So what can we expect in this program itself? Or will the program be administered?
One of the challenges we know face our people is finance. And sometimes, and that is one of the reasons why we sometimes only see them, our doctors see them after the damage has been done. So just like we encourage persons to know your blood pressure reading, your sugar readings, we are thinking that if we can get the population to be conscious about your eye pressure, to know what it is, if even once, at least later on, we can know a shift. There's some changes in that, and you start the intervention. Because it is sad when we are finding them out when the damage has already done. And you know, one case in point that really touches me is my good friend Senator Floyd Morris, who is a patron. And when I spoke to him about this vision, and I said, Floyd, you got blind at 19, but yet you're so successful. I know it could not be easy. You're ready to do your subjects and books. And he said, Mark, the reality is if I had the financial backing, I may not, it is highly possible I would be seeing you today and see what you look like. And it touched me. And I look at it, and I put myself at 19, and I said, Floyd, I want you to also be a part of this, because I would never want to know that we have allowed another teenager to go blind because they never knew what their number is. And so he's going to be a part of this. He's a patronage. He's glad for it, and he supports it wholeheartedly. And so those are the kind of things that when you look at it, had he had the financial backing and they picked it up, you understand, it's a treatable disease. We don't want to see that happen. And so one of the focus we are having is that once we are discovered, we're going to have planned intervention. So from 3 Angels Pharmacy end, we want it to be a case where, and this is in keeping with the National Health Fund policy, where it's for every single citizen. Once you're discovered and you're diagnosed and you're passed on, we would love to know that, hey, you can now qualify for a National Health Fund card. They have just added 5 more conditions, so they cover now about 22 chronic diseases. Thank God glaucoma was on it from before. And so we're saying once you're diagnosed with this program, we don't want money to ever be a case, should never be a deterrent factor for you to be treated. And so with the National Health Fund card and with our distributor, the persons within this group would really love for them to probably little or nothing out of pocket. And if they don't have, we will not want a case to be where they are not given the drops to be treated, if eye drops is the intervention at the time. And so we are committed to this program to ensure that for those who are discovered, the only deterrent would be, and even if it is, I know that especially in our rural areas, I've seen it as a community pharmacist, where they come before you and you ask for an NHF card because you see the cost. They don't have one. But they're not gonna, they will just leave because of the cost. But then you say to them, did you know that if you have an NHF card, instead of paying $6,000. You could be paying three, four, maybe $600. And they said, really? But why you don't have one? I don't have a birth certificate. Because if you don't have a birth certificate, you can't get a TRN. So, you see the dilemma. So we have a social dilemma now. So, a part of this campaign is to encourage our citizens of Jamaica, for those, the elderly, if you don't have a birth certificate, we are begging you, get one. Because when we find you, we are going to be allowing you to register with the National Health Fund, because you're now diagnosed with a chronic disease, glaucoma, just like hypertension or whichever. And so you are doing an injustice to yourself by not having a birth certificate to get a TRN, to get an NHF card, which can literally cover your glaucoma treatment for literally little or nothing. So we are going along that line to encourage the citizens as a part of this public campaign that it's us as business persons, along with a government entity, NHF. If we put all of that together, when we discover you, when you're found, we want you to know that, hey, you have some responsibility too. And therefore, if you are diagnosed, you have a part to play in this. And your part is to ensure that you access that aspect of the program where your NHF card is it doesn't take more than 5 minutes now. People are surprised when I say to them, why don't you go sign up? And they come back and said, wow, I didn't know it was so easy. A lot of people think that, I don't know why we think once you have a form and you have to fill it out, it's a difficult process, and it's not. So part of the campaign will be educating our people as well to know that there is treatment out there. There are programs there out there. We just want to be facilitators of this, and we're going to put our own resources in it to assist in what we can with this aspect of glaucoma in this neck of the wood, and hopefully spread to the entire Jamaica.
There's another side to the NHF card, but afterwards I'll discuss that with you. Where can we get the screening?
All right, so this is how we envision the entire program working. We have screeners that will go out, and at the first stage we're looking at what would be considered a glaucoma suspicion. Pressures are high, or the second level is a detection, which would be the optic nerve has the characteristic damage that glaucoma has. After that, the person would be referred in to our facility, and this is where we're going to be dealing with widening the base of care, because so far all developed nations have recognized that one specialty, the ophthalmological societies, not enough manpower to handle this monster that is not only here with us but projected to loom its head even larger. And so in the UK there's optometry driven discovery of screening and finding the situations. In the US, co-management optometrists are treating glaucoma. In Australia, optometrists are finding the situation, diagnosing, and beginning treatment. So it was this year that an article came out in the American Academy of Optometry, and it said teamwork has to be the key. And the teamwork, the T actually stands for training. So here we're going to be looking at any medical specialty or system, health system, that is outside of the traditional ophthalmology setting, but that would act as an aid to what we already have. So there's training. We're looking at GPs being very involved in this. They're going to be involved with counseling. They're going to be involved with having had information that the pressures are high or the optic nerve is damaged. Get involved with helping to start a program, initiating the prescribing, where we have patients on medication for at least 4 to 6 months. And then what we're going to look at now is a glaucoma confirmation. So around the 4 to 6 months mark, we will have subsidized laser scanning done on these individuals. Something that would normally be 15,000, we're having input from New Vision, and they're going to be subsidizing along with our office so that the patient will only pay 1,000. And at that point, the patient will have a map of what their peripheral vision is like. Has glaucoma taken toll as yet? Is it just on the edge? The scan will show if there's damage to the nerve fibers, and then we're looking at handing over to the ophthalmologist so that they know, can regulate their time better. They can now plan, do I need to see this person every year, every 6 months, every 3 months? But they would already have had quite a bit of the groundwork done, and that is how we see the screening leading into something that's workable, using, activating, and mobilizing pre-existing medical-related professionals. They get involved, right? So the GP, the optometrist, along with the ophthalmologist, working so that we can do community-wide interventions.
I suppose you answered the other question I had about the program cost to participants. So how many people do you hope to reach in a year?
I looked at, I think based on the first year, I think we can reach 300. And then after that, he'll brainstorm how we actually expand, because it will be scalable.
Yes, yes.
So what do you do when you have a big number turning up for a clinic? How do you decide who is seen and who is not? I'm sure this is going to really.
We know.
I think one of the thing, as I look at it, we might have to do is sometimes we allow them to call us. You know, inside the clinic, we allow you to, you're keeping something, you get in touch with us. We could also, for example, we may want to visit a place of work, or a church might have a church hall, and you go down, you go to RADA, and you might say, RADA, you have your farmers, and would like to, come by to one of these days. And so you can probably select your crowd as you go along. And on the general scale, as Dr. Riley said, you could probably look at your pre-existing conditions and see who would best be the ideal person to screen. So you know, within the working and fine-tuning that, but then you don't want to turn away anybody. But the beauty with a mobile clinic that you're gonna find we're gonna go where you are. So we're gonna come to your churches, your gatherings, your social, wherever you are. You're keeping your health here. Let us know. This is the one stop for that, and we it will be unique in that most of what is going to be used are mobile instruments, very very sensitive and easy, and we are so appreciative of Dr. Riley in our research and finding them, and they're not cheap, and so I know a lot is invested in this, and it's all out of seeing a need and want to be a part of the solution. It makes no sense we sit and watch these things happening to our own people, and you wait on somebody to come from overseas and do this grand thing. But we are here. It's our people. We are seeing them. You know, it's our grandparents, our friend grandparents, or whatever. We can do something, and we would. Our hope is that this will light a fire to spread, and others may see this and collaborate like this in tackling some of our disease conditions.
Why I ask that, because most of the clinics I've been to, once you have either a dentist or an eye doctor, I mean, even the doctor himself doesn't see as many people as the eye doctors or the dentists. Where can you find out more about this program?
All right. So
Will you have a brochure out? Or?
Yes, we will be doing that through the Three Angels website, Three Angels Mobile Clinic, Clearsight, Ophthalmic. I think you have a website, Doc? Yes. A New Vision website. So each of us will also link it to this program.
Yeah.
We're going to have a YouTube channel so that people can see the work that we're doing. We probably, social, Facebook page, as we go along. So we want it to be easy. At least if you call 300 Pharmacy, or you call New Vision, or you call Clearsight Ophthalmic and ask about it, somebody should be able to say, okay, know exactly how to refer you. And therefore, we do the bookings and see how best we can accommodate.
I suppose you have to make sure you tell people in advance that you have to book your thing there,
Yes.
with the crowd, overcrowding. Are you open to additional partners? And if yes, how can they become a part of this project?
Of course,
We just have to
we'd be open to because it can be quite an expensive venture. We are wetting our feet. We're going by faith, and we know it's a worthy cause, and it's for the good of the nation, the good of the people of our country, our own people. And so any organization who wants to partner with us just need to let us know, and we can share with you how you can assist, because sometimes, who knows, you might find persons might just need surgery, and it might be costly. We see how we can negotiate with the health practitioners to get that down, and I'm sure, knowing my people, my Jamaican people, it shouldn't be a tough task to assist. People know when you're genuine, and if you're doing it out of love, they know, and they will support. And this is all a love gift to our own people. And based on what we are seeing, we know what's happening. And we are just saying, we want to wet our feet and put our how do they put it? Put your money where your mouth is, and start something. It's expensive, yes, but we want to start by faith and hoping that as the months progress and the interventions are done, we should have a smile on our face when we say, okay, at least we see these cases and the intervention works, and put a smile on somebody's face.
I know in the beginning you had said that NHF, you had been able to work a deal with NHF. I don't know if it's a deal or what.
When I say a deal, I mean the good thing is that NHF always, it's there already in terms of covering. So the 60 and over, the program is already there that they only pay $40 for glaucoma medication. So they have about 3 on the program. So that's a big help, So you have drug that regularly might cost you $4,000 or $5,000, $3,000. You pay $40 for your 60 and over. Also, for those who are under now, it covers a particular figure per drug, and then there are generics on the market, means that they are cheaper drugs, so you get to spend less out of pocket as a result of the generics. And so we're going to put all of this into play, and so, and I know how the NHF operates. If there are programs that they see where they can actually inject more and to assist, you can always write them, and I know they have a structure, and they will assist.
Will they get medicine on site or?
Yes, that's one of the pluses. We want to ensure that the clinic travels with glaucoma treatment, so that when they are discovered, we can right away initiate. So like your GPs, like you, could start the process, and then, and as Doc said, you follow them, and then you hand them over now to the ophthalmologist, so that we know that, okay, here is a few patients that we realize need your intervention. And then that in itself, now we might have to form a caucus with our ophthalmologist to say, well, your fee might be X, but in these cases that we are bringing to you before the damage, would like you to, some consideration, because it's all in the total of assisting our people.
Any other drug company on board with you?
Yes, New Vision. New Vision as a distributor, and Mark did say that he's in this to help the people. So his contribution is monetary towards screening and the scanning. He commit funds to that. He's also a distributor of eye drops, many of them to treat glaucoma. He will also chip in as well, and so it's all three of us directly involved in glaucoma medication. Doc as an optometrist has equipment to screen and to see it, and so we have our MDs who will be able to take it a little further and pass it on to our ophthalmologists as we see fit. But the aim is to catch them, intervene early, and bring them in the system where they are treated and maintained.
Well, Mr. Ron McNally, the ever hard-working visionary. I mean, as you celebrate 18 years and 6 years of a clinic, and now we're going into the first year of the eye clinic. And Dr. Riley Ricketts, Clearsight Ophthalmic Consultant, trained as pharmacy and the New Vision Distributors, collaborating to deliver glaucoma screening and intervention. Thank you so very much. And keep up the wonderful, great work.
And thank you, Dr. Tolan,
Thanks, Doc.
for your commitment
Yes.
to our worthy cause.
Mhm.